Good day, everyone. Welcome to Smart Spark Academy. Please, if this is your first time coming across our channel, do well to like, subscribe, and leave a comment. Also, share with your friends. Okay, today we'll be looking at osteology of the humerus. This is my anatomy babies. We're looking at the description of the humerus. What the humerus is all about. As you all know, the humerus is the bone of the hand. We'll be dividing the humerus into three so that we would understand it better and easier. This is the head, the shaft, and the distal end. So we can divide the humerus into three: the head, the shaft, all the body, and the distal end. Look at it. This is the head of the humerus, the shaft of the humerus, and the distal end. Now let's study the head of the humerus. Now, this head of humerus has the ball. See the head here? It's like a ball that attaches with the glenoid process of the scapula to form the glenohumeral joint. That's the first joint that the humerus forms, the glenohumeral joint. As the name implies, glenoid process of the scapula, humeral, the humerus. Now, the humerus has two neck, the anatomical neck and the surgical neck. Now, this is the anterior surface of the humerus. That's the anatomical neck and the surgical neck. Looking at it anteriorly, you would see that there's something like a ridge. From this head of the humerus, there is what we call the greater tubercle. Now, this is positioned laterally. See, this is how the humerus is. Remember that in anatomy, lateral is away from the midline of the body. The head of the humerus has this greater tubercle, it's bigger, which is positioned laterally, and you also have the lesser tubercle. It is smaller, that's why we call it lesser. Greater is bigger, lesser is smaller. And now it's positioned medially. It is coming towards the midline. So I've made mention of the greater tubercle and the lesser tubercle. Now, if we look closely, we will notice like something divides this greater tubercle from the lesser tubercle. Now, this is known as the bicipital groove or the intertubercular sulcus. So we mentioned some key components of this head of the humerus: the greater tubercle. This is the head. This is greater tubercle. I remember I said it's positioned laterally. The lesser tubercle positioned medially, and we have something dividing there, which is the bicipital groove. The bicipital groove divides the greater tubercle from the lesser tubercle. Now, this greater tubercle comes down. I want you to take a good look at this. It comes down and forms the crest of the greater tubercle, while the lesser tubercle also comes down, like it extends to form the crest of the lesser tubercle. Now, in this intertubercular sulcus or the bicipital groove, The proximal tendon of the long head of bicep brachii is found here. Intertubercular sulcus. Remember I said you can also call it the bicipital groove. Have the proximal tendon of the long head bicep brachii muscle. Now this is a muscle that attached to this intertubercular sulcus. I believe you're with me. We've talked of the head, greater tubercle, lesser tubercle, and remember I said the greater tubercle comes down to form the crest of the greater tubercle. The same thing with the lesser tubercle, it comes down to form the crest of the lesser tubercle, while this space that divides the greater tubercle from the lesser tubercle is called the bicipital groove or the intertubercular sulcus, and what attaches here, the proximal tendon of the long head of the bicep brachii muscle. Now let's look at the neck. Let's study the neck of the humerus. Humerus has two neck. Let me underline this so we know what we're talking about. We have the anatomical neck and the surgical neck. This is the anatomical neck. Now it is proximal to the greater and lesser tubercles, proximal or close to these tubercles. Then the surgical neck, this is where it is. Look at the anatomical neck, and this is the surgical neck. It is distal. It's a bit farther from these tubercles. Now, this surgical neck is actually very important when studying about the humerus because it is prone to fracture. It is prone to fracture. And it is called surgical neck because it often requires surgery if it gets fractured. So that's that on the neck of the humerus. Now let's study about the shaft or the body of the humerus. Now let's look at the shaft or the body of the humerus. Is this long part of the humerus here? It's divided into two, the anteromedial surface and the anterolateral surface. Don't forget that we are looking at the anterior surface of the humerus, the front of the humerus. Now, this anterior medial surface, or sorry, the anterior border extends from this crest of the greater tubercle as it runs down towards the distal end of the humerus. Take a look at this. Now, this is the crest of the greater tubercle coming down from the greater tubercle. If you notice, it has a ridge, it runs down to the distal part. So this is the anterior surface. That's how you recognize the anterior surface of the humerus. Look for the greater tubercle and try to get the crest. Run down. That's the anterior surface. Now, on this chart, there's a very important structure which we call the deltoid tuberosity. Now, this is deltoid tuberosity. If you notice, it's roughened. It has a roughened appearance. It's rough. And it is found lateral mid-shaft of the humerus. This is it. Lateral is away. You just see it here. It's very, very easy to find. And it serves as a point of attachment to the deltoid muscle. So from the name you get it, deltoid tuberosity holds the deltoid muscle. Now that's that on the shaft of the humerus. I think this is the only notable structure, which is the deltoid tuberosity. And let's go to the distal end. Distal is farther away, so we are going to the down part of the humerus, distal end. It has some notable structures. We will consider it anteriorly and posteriorly. Now we'll consider the anterior, the front part. Then we'll turn to the back and look at the posterior, which is the back. One easy way to differentiate the front and the back of the humerus, anteriorly and posteriorly, is that the posterior, which is the back, has a dip like a fossa, a depression, one, just one. So if you just look, pick up your humerus and you see the part that have one depression, one hole, know that it is the back, it is the posterior surface. Now if you see the part that have two shallow depressions, that's the front, which is the anterior. Now if you ask, what if you see a humerus and you want to find out, is this the left humerus or the right humerus? You just pick it up, check that one deepening. Let it be facing your back. As you can see, this is my right, this is a right humerus. So it's very easy to identify. Now let's look at back to what we have, the distal end. The anterior surface of the humerus, note we are considering the distal end, has two fossa. It has a pair of fossa, the radial fossa and the coronoid fossa. Now these are the pairs. Look closely. We have one and two. Now this is the coronoid fossa and this is the radial fossa. How do you know which one is radial? How do you know which one is coronoid? Now position your humerus. Coronoid is medial towards the body, while radial is lateral. So let me write it down so we will not forget. Radial is lateral and coronoid is medial. Now, the radial fossa is lateral and the coronoid fossa is medial. Now, note that this fossa serves as a point of attachment. The radial fossa accommodates the head of the radius. Now, I know that the radius bone is one of the bones of the arm, of the hand, sorry. Yes, we have the radius and the ulnar. Now, this radial fossa, as the name implies, holds the head of the radius. Radial fossa, head of radius. While the coronoid fossa holds the coronoid process of the ulnar. I don't know if you get coronoid fossa, coronoid process of ulnar, radial fossa, head of the radius. Now, distal to it, we have the trochlea and the capitulum. These are the fossa, this that the trochlea and the capitulum. Now, this is the trochlea, while this is the capitulum. We'll talk about it shortly and what they are for. This is the trochlea and this is the capitulum. I want you to note that we have the epicondyles, the medial epicondyle and okay, no, there's no lateral epicondyle. I want you to note that we have the epicondyle, the medial epicondyle and the lateral epicondyle. We also have the supracondylar ridge, medial supracondylar ridge and lateral supracondylar ridge. We'll talk about each of them. The capitulum of the humerus, this part, articulates with the radius.